All right. Good afternoon. Welcome to a midsummer town hall. I appreciate all of you being here today. These are the things that we're going to talk about. I have a few Way to Go awards. I've really been enjoying distributing these. You know, we have so much great work going on here, great people, all of you. I think everybody eventually should get a Way to Go award. But today I have an opportunity to recognize 3 individuals. I'll talk more about that in a minute. Some good news, just reporting on some other good things that are happening with our people. A quick update with regard to best care, what the latest data that we've processed shows us, and where we go from here. A number of people ask me, well, what's the status of the construction projects? What's going on those? So I have a single slide that sort of bunches all those together just to remind us what's going on and what the timelines are that are associated with each of the projects. A bit of a financial update. When I talk to people around our campuses, out in our clinics, they say they actually enjoy hearing about financial performance, but they essentially want to know, bottom line, how we're doing. So we're going to use the presentation format today that I used in the last town hall, which compares how we were doing this time last year with how we're doing now, so year to date, and also compare that to what we had budgeted, and then we'll look at where we stand, talk about how we're doing and what we do to close out this last 6 weeks or 7 weeks of the fiscal year. A few slides relative to the legislature and what it did to us. So we'll talk a little bit about that, and Dr. Raymer can answer any specific questions you have about that. He and Lauren Shear, who's also here today, along with all of our legislative affairs staff, worked really, really hard during this legislative session. It was a difficult one. We knew going into it that the legislature didn't have enough money available to it to cover all of the existing programs, at least to the amounts they had been funded in the past. That always makes the session more difficult. But also, the current state of politics, how we're sort of wrestling with issues and perspectives around the country, is also being mirrored here in Texas. And there was acrimony and angst associated with conflict between positions. And I've been attending Texas legislative session since I was a teenager, when I participated in Boys State a number of years ago. I've never seen one like this one. There was so much conflict, so much angst. You heard about the demonstrations, about some of the actual physical confrontations. We've never seen that before, at least at the state level. So it was frustrating for us and disappointing. At the same time, our legislative affairs staff worked really hard, and I think they assured about the best possible outcome that we could achieve. So thanks to them. We'll talk more about that when I get to those slides. And finally, just some general updates. There is I think an improvement in our UT Select health insurance plan. I've got a couple of slides to talk about that. Responding to something that we've been requesting as employees for some time, a little bit about UTMB Discover, which is the title or the name that we've given to our predictive analytics big data program that we're beginning to apply in detail using some special tools that we've acquired along with some that we've constructed. So talk about the status of that and its priority for us. We'll have a little fun with Facebook before we close, and then I'll take whatever questions you have. So let's get into this. Let's start with the Way to Go Awards. I have 3 people to recognize today, and what I want them to do, I think they're all here, is to come up one at a time and receive their blue shirts and their pins, and then when all 3 are up here, we'll take a quick photo, and then we'll move on with the presentation. So the 3 of you, I promise not to embarrass you for more than a few minutes, okay? All right, so the first is Sarah Burnett. Sarah, are you here? No, come on up. Thank you very much. So as you can see on the slide, Sarah is a medical lab specialist in the blood bank transfusion operations. Sarah, thank you for doing such a marvelous job. Here's your shirt and your pin. Now, the way this works is people send me essentially nominations, and they tell me all about the great work of an individual. And I think your nomination went on for 3 or 4 pages. I can't possibly remember all of the great things that were said about you. Everything from just marvelous volunteer work that you do in the community outside of here, to all of the things that you do to make sure that we're using this precious resource of blood bank and blood products appropriately and safely, educating people in best use, looking at performance, everything that you can do to help us make sure that we use this resource very wisely. So clearly well aligned with our core values, exactly what we want to do as individuals, pursuing excellence. Thank you for great work and congratulations. Next is Brenda Lundy. Brenda, are you here? There she is. Come on up. Now, I think everybody knows Brenda who's walked through the UHC lobby, because she is there at the information desk, and to me, she's like an air traffic controller. She is making sure that everything and everybody is going in the right place, not by being intrusive, but by offering assistance, and in some cases, encouragement. So again, a long list of really things that you do and that you've done helping others. Everything from just making sure that patients who need special assistance receive it, to really acting very bravely and appropriately in a very cool-handed manner during the fire, making sure that people were following our evacuation plans, doing what they needed to do. And we all appreciate your friendliness and your very apparent compassion and respect for others, Brenda. So thank you so much for living the core values, and congratulations. Thank you. I'll do that for you. Finally, Betty Shipp, who is a nurse who works in the care management program. Betty, are you here? There you are. Please come up. Congratulations. Now, again, a long list of achievements and accomplishments that are attributed to you, but the message that comes through is how you just go beyond the extra mile for all of the patients that you assist. And all kinds of stories about patients with special needs who have been to our ER multiple times, admitted multiple times. They had incredible social barriers that nobody else could help them overcome. But in every case, you did that. And you helped improve their social status, their health, and their lives. So what an amazing set of accomplishments. Thank you so much for brilliant work. We appreciate what you do, and congratulations. We'll get Stephen to take a picture. You'll step over here in the light a little bit. Thank you all very much. Congratulations. Thank you for great work. And if anybody who's here in the audience or anybody out there listening has others who you think are deserving of this recognition, please send a note to me, and we'll consider that and hopefully get a chance to provide the blue shirt and a pen and a little ceremony for them too. All right, so some other folks who deserve congratulations. Donna Sollenberger. Donna's over here. She is the newly installed chair of the board of directors for America's Essential Hospitals. Now, this is the group of predominantly safety net hospitals, many of which are academic medical centers from around the country. And they play a very important convening role in bringing us together, health systems like ours together, to think about this special mission that we have to care for all patients, all backgrounds, all sorts of socioeconomic issues, the special needs of those patients, what are current best practices, and how we can apply those and improve them over the course of time. And of course, the thing that goes along with that that's so important is advocacy, particularly at the federal level, talking about the special needs of the particularly vulnerable groups of high-risk patients that we care for, and help making sure that public policy is as good as it can be so that we can do as good a job as we can in caring for the special needs of those patients, not only addressing their healthcare needs, but the socioeconomic barriers to good health that they often have as problems. So Donna, I appreciate you taking on that role. We know you'll do a great job. I know one of the first things that she did was to meet with the new CMS director, Seema Varma, and explain some of the challenges that we have with the current Medicare and Medicaid rules and policies and the like, and had an opportunity to help her think about some improvements that could occur over the course of time. So that's exactly the sort of conversation that we need to be having with our administrative leaders, our elected legislators, and I know Donna will serve all of us well in this role. Next, Dr. Reyes. I know a number of you here know Dr. Reyes. I don't think he's here. I didn't see him. Victor, are you here? There you are. Yeah, there you are. Stand up. A hand for Dr. Reyes. So he was a recipient of one of the 10 Piper Professor Awards that's given to professors at Texas colleges and universities in a year. Every year, there are thousands of college and university professors nominated for this award, and the foundation selects 10. So that's a very significant honor, and of course, Dr. Reyes is so deserving. He's an outstanding teacher, a marvelous member of our faculty, but we're extraordinarily proud of him. Also proud of the fact that over the course of the past, I think, 5 or 6 years, we've had 3 Piper professors, including Dr. Reyes. So again, attesting to the significance of our education programs and the quality of instruction that occurs within our 4 schools. So Victor, congratulations, well deserved. We have this year 5 recipients of the Regents Outstanding Teacher Awards. Those will be given during the Regents meeting in August. Lynn Knox, Ron Levy, Anita Mercado, Joan Nichols, and Mary O'Keefe are the most recent UTMB honorees. They said last year they were going to reduce the number of these awards because they felt like they had recognized most of the great teachers in the system. So I was very hopeful that, we would get 2, maybe 3. And when I found out that we have 5 faculty members being honored, I said, wow, again, just another great example of the fact that we have great educators here and people outside our institution recognize the quality of our faculty members. So when you see any one or more of those 5, please congratulate them. Finally, congratulations to our media and communications group. They have received a couple of significant honors relative to work to educate the public about Zika. When the Zika crisis first came to light with a focus on Brazil and the possible impact on the Olympics, there were very few people, researchers in this country, who really had any firsthand experience in working with the virus or knowing anything about the clinical outcomes. Well, we were one of the places in the country that has a lot of expertise. So we were able to get a lot of information. Our media and communications folks assemble that and put together some pieces to go out to media around the country. So Raul, stand up, be recognized. Great work, and exactly what we're supposed to be doing, taking advantage of the incredible expertise we have across a variety of fields, across the spectrum, if you will, of health interest and health care, and assembling it and putting it out there to help educate the public so that they know what to do to protect themselves, to improve their health, to prevent illness over the course of time. Just another example of the great work. So again, just an opportunity to say thanks to some of our individuals who are doing great work and to congratulate them on the recognition that they've received. All right, so let's talk a little bit about Best Care. And I saw Dr. Sharma walk in, so he can keep me on the path here. There he is. Gulshan, thank you very much. I'm doing marvelous work with our clinical faculty, our clinical leaders across the health system, the academic enterprise, to move us towards our Best Care goals. I think we've all talked before. We talk a lot about the fact that everybody here is committed to excellence, no matter what we do. We want to be the best in delivering health care and doing research and educating students and other healthcare professionals. And everybody's striving hard to do that. There are more and more outcome measures that are being developed to help us compare our efforts and our outcomes to those like us around the country. Well, this big group called Vizient, named Vizient, which is formerly the University Health Consortium group of 102 academic medical centers, have developed a number of outcome measures associated with the delivery of health care. And so Vizient has a very active set of processes to help us compare our own efforts and outcomes to those like us around the country. So that really is the basis for the comparisons within our Best Care effort. When we first started looking at these outcomes, we weren't too pleased relative to our ranking compared to others, because we know that we have great people, they're delivering care. Why do we have a lower ranking between 75 to 95 across the variety of different measures? Well, it turns out that certainly we can improve our processes, and we're working to do that. But a lot of this really is about how we describe what we're doing, how we document the status of our patients when they arrive, what we do in terms of delivering care over the course of time, and how we describe their outcomes. So we focused a lot of attention on making sure that the excellence in care that's being provided is appropriately described so that we can truly record, understand what's happening with our patients, and then be more effectively compared to our peers around the country. Well, we've done pretty well. I think Dr. Sharma and others who are really intently involved in this effort will tell you we still have lots of work to do. But overall ranking's gone from 76 to 19. So that means we're in the top 20% in the country based on our most current set of complete metrics. That's great work. So I'd like for you all to help me recognize that, applaud the great work. And continue to spread the word that this is not just work for clinicians. We're all really connected to Best Care. Our efforts here are a reflection of our vision to be the best at everything we do. We want to continue to strive to do that and improve our overall performance. So this just goes into a little bit more of the detail. You see that overall ranking at the top of the slide. You see 2016, 76, mid-year ranking 2017, 19, and then the breakdown in the various categories: mortality, safety, effectiveness, patient-centeredness, efficiency, and equity. And there are different metrics that go into the calculation of those overall scores in each of the categories. Now you can see, if you look across mortality and look at efficiency, so really the first from the top under overall and second from the bottom, we're still not doing as well as we'd like to do. And we continue to look at that, analyze that. Here's some additional efforts, more specifically focused on improving our rankings in terms of efficiency and mortality. So coding enhancements and training, going back to doing a better job of describing the status of the patients when they arrive, during the course of their care, and when they leave. and also all the things that we're doing to try to help improve their health while they're here. Continuing to look at our processes of care. Are we doing the best? Do we have the best evidence-based practice processes in use? If not, what do we need to do to change that? Looking at the evidence that supports the best practices that we're using, continually questioning, trying to improve. And also just some other simple things. We have a lot of trainees who are involved in delivering first-line care, who work beside our nurses and the like. We need to make sure that they feel comfortable and empowered, also that they have enough knowledge to know when to escalate a concern about a patient to a member of the nursing staff or to a faculty physician. So there's certainly a lot more complexity to this, but those are the high points. We want to continue to focus on this. I guess third quarter results are actually due tomorrow. Is that right? So we'll have more information about where we stand. Preliminary returns look pretty good, but we'll know more when we have a chance to take a look at those third quarter results. And, bottom line on this slide, why are we doing this? We want to be a high-value practicing organization. Remember, one of our major pillars with the road ahead is value. What's value? Outcomes or quality of outcomes over cost, right? And as we go forward in healthcare, we continue to look at value. And value will continue to be the principle or one of the principal sets of measures that's used to evaluate how we do. If we can't show that we're delivering very high value health outcomes in the future, then patients will be directed away from us. Now, as an academic health center, obviously we're interested in creating high value care. In fact, we're charged with continuing to improve the value of the care that not only we deliver, but others like us deliver around the country. So this is a very important effort that's perfectly aligned with our academic mission, and it will remain a priority for us as we go forward. We're doing well, but we still have work to do. We appreciate everybody's engagement in getting us to where we are today. Thank you very much. All right, shifting gears, construction. So again, not a lot of detail here, but what people have told me they really want to hear is, okay, what are the projects and what are the approximate timelines from where we stand to completion? So first is Research Building 17E. You remember that this building adds significantly to our animal care infrastructure, our capabilities, helps us make sure that we're meeting not only current but projected future accreditation standards, and also adds a little additional research space for us. So that will be opening in November. That construction timeline is on track. Our Health Education Center, which is being constructed just outside the doors over here, our tower crane was erected in June. We expect a topping out set for December, and we plan on operationalizing that building in the spring of 2019. So that means our students coming in for the fall of 2019 or the beginning of fiscal year 20 will actually be receiving instruction in that building. The John Seeley modernization, you probably see all the work on the facade on the east side, or the AB wing. They've erected most of the scaffolding around the outside. They're still, I think, working on the south face now. But the idea is to take that veneer off, to actually move some walls back, enlarge the rooms, do the corresponding interior work. Because of the way the building is constructed, we basically need to do the AB wing, then move folks from CD to AB, and then do the CD wing. So our time frame for completion pushes us out to 2020 to get the project completely done. But right now we seem to be on track and doing well. By the way, if you drive down Harborside Drive and you get down towards the railroad tracks where the road curves from its east-west direction back to north-south, you might notice on the south side of the road there's some big window plates stacked up there, and a lot of little cannons and water devices and the like. That facility was actually constructed when we were building the Jenny Seeley. And that's where they tested the integrity of the windows and a lot of the frame structure and the like. Well, they're doing that now with what we plan with the John Seeley Tower windows. So if you drive by there and you suddenly see a big piece of debris hurled at the windows, hopefully it bounces off and doesn't go through. If it goes through, we have to rethink our approach. The League City 2017 expansion, what is beginning now is construction of a 7-story parking garage and a support building, which will house some offices and possibly some clinic space in the future, as well as the long hallway, which will connect the parking garage into our hospital in the MD Anderson complex. So the garage is designed not only to support our current hospital and the MD Anderson clinic that's being built there, but also the future expansion of our hospital. So that's why we're building such a large garage now. That essentially will be done next spring. I think May or June is a projected completion date. And that's about the time that MD Anderson's building should be completed. And so we'll begin to use the parking garage. MD Anderson will vacate their construction site, and we'll actually begin moving in our construction equipment to start the next phase of expansion, the 60-bed expansion of our hospital. So that's the way that will work. We plan to have that hospital expansion open in about 2020. So a lot going on out there in construction. Some little things around the campuses which disrupt traffic to a certain extent, but in general, these are the big construction projects right now with projected completion dates. Okay, financials. All right, this is a slide format that we've used, I think, in a couple of town hall presentations now. And this is where we were last year. So this is year to date through May. So through the third quarter of the year, here's where we were last year through May, the actual results. We had about a $5.1 million operating loss with adjusted margin. Not operating loss, adjusted margin loss, sorry. Here's where we are this year, 2017 actual numbers. So about a $2.3 million loss in the adjusted margin category. So we're better this year than last year. So here's the variance. We're $2.8 million to the good compared to where we stood at this time last year. Now, here is our budget for this year, and we actually projected to be $11.9 million in the red for adjusted margin. So you can see here's the variance between budget and actual. We're almost $10 million to the good. Now, considering the fact that we had the John Seeley fire, and we think we had about a $10 million operating loss associated with the fire, we're doing pretty darn well. So thank you very much. Congratulations. We're exceeding our budget. Absolutely. That's good news, and we're going to do the best we can actually to make this overall actual number turn positive before the end of the fiscal year. We certainly at least like to get that to about 0 if we can. We're on track to do that. So we'll all watch expenses and do everything we can to make sure that happens. But bottom line, you can see that we're doing well financially for this fiscal year. So thank you and congratulations. All right, legislative update. So bottom line, our state funding was reduced by about $15.5 million compared to what it had been for the current biennium. So remember, this is for the biennium that starts with fiscal year 18, the two state fiscal years, 18 and 19. So we're $15.5 million negative compared to what we had for the 16-17 biennium. That's about 2.7% of our overall appropriation. If you remember, the Senate and the House had two very different approaches, and they reconciled those at the end and essentially did an overall cut to our formula funding. Formula funding brings a lot of dollars, and it's broken down into various categories that support education, research, infrastructure needs, a few other things, employee support, and the like. And so there was a cut in terms of formula funding. We also saw some significant cuts in our special item funding. And so I don't detail those here, but both formula and special item funding were cut by the legislature. So we're going to reduce the size of some of the programs. What we've done is we've redistributed the dollars, if you will, to make sure those things that are funded by formula are kept whole, okay? So that means the instruction programs, the academic programs, and the like will not suffer any reductions relative to what they received in 16-17. That means most of the reductions are going to occur in those special item funding areas, and essentially that's what the legislature told us they wanted. They wanted reductions in spending associated with some of the special item projects that we do. We'll have some reductions mostly in community health outreach services and some primary care education programs that won't have any significant impact on our campuses or our clinics. So we're essentially managing those cuts, absorbing them to the degree that we can. Some of our community outreach programs, however, will be negatively impacted. So I know our CMC folks, you typically tune in. They want to know about what's going on with legislative funding for CMC. Well, there were some good things. We've been asking for funds for infirmary beds for some time. Infirmary beds are those beds that have a higher level care than what's available in the prison units, but a lower level of care than that supplied in the hospital. Because of a relative shortage of infirmary beds, we've been keeping patients in the hospital longer than they need to stay, and of course that drives up cost. So a good outcome is the legislature's funded some additional infirmary beds, so we think that will help us reduce overall length of stay at Hospital Galveston and some of the other hospitals and lower the overall cost of care. They've provided some additional funding for some healthcare worker positions that are sorely needed out in the units, and also once again funded a salary increase. This is their CMC workers, you remember, are one group of employees who have to have any increase in their salary approved by the legislature. The legislature has to approve those funds. We don't manage those on our own. So they did do that for the biennium. We're very pleased about that. They also funded what we call the supplemental appropriation request, which basically is the amount of money that's projected to be the shortfall between what was previously appropriated and what's actually expended. So for each biennium, we estimate that a certain amount of money will be needed to provide care for the offender population. So if they don't fund that full amount, a shortfall occurs, they have to go back and create a supplemental appropriation to fund it. They did that for the shortfall that's going to occur at the end of this fiscal year, the second year of the biennium. So that's all good. Challenges, well, they really underfunded the next biennium, the total amount for care by, we think, up to 100 to maybe even more, like 120 million. So that's a big issue going forward. They changed our reimbursement rates for hospital inpatient care, which is something that's a concern for us. We were basically reimbursed based on cost previously. Now we're being reimbursed based on a Medicare formula, which is going to cause us to change the way that we document the care delivered to our inpatients in Hospital Galveston. They lowered the overhead cost adjustment that they typically provide from about 4% down to 2.75%. And also, they did not give us any funding to support capital investment needs in the hospital. The hospital is in pretty significant need of repairs. We asked for funding to support that, and they said no. So these are all challenges for us. We're looking at these, how we might work with our TDCJ colleagues to address some of these needs as we go forward. But essentially, this is what we got, some positive and some negative for the current biennium. All right, so as you know, they're coming back for a special session that convenes on July 18th. The governor's given them a list of about 30 charges, including school finance, teacher pay raises, a reauthorization of the Texas Medical Board, which sunsets at the end of this current biennium, and also ask them to take a look at some property tax laws and changing those. So the governor can call as many special sessions as he thinks it takes to get the required work done. They go for 30 days, so we know they'll be in session for at least 30 days. As far as we know, there aren't any major issues impacting our funding out there, but we'll certainly be tuned in closely to see what happens during the course of the special session. We'll be working with the members of the legislature and their staff members during the time between the end of the special session or sessions and the next legislative session to talk about some of the needs, including the shortfall in CMC funding and some of the cuts in the state's Medicaid programs. So the work continues. We take a little bit of a breather at the end of a legislative session, then we start planning for the next one. But all in all, considering all of the challenges associated with the session, I think we did pretty well. Again, thanks to Dr. Raymer, Ms. Scheer, and the entire Legislative Affairs team for working so hard to try to keep us whole. All right, so let me shift to the health insurance change that I wanted to talk about. This is a positive change from my perspective. I've got a little chart after this. You know, for some time, we've been asking the benefits managers who oversee our health insurance plan to consider creating some discount for our employees who receive care at UT Health institutions. And there's been some resistance to that over the course of time, but we've been successful now in terms of creating an arrangement to reduce overall costs for employees who receive care at one of these 4 UT institutions that's listed here on the slide. So you don't have to make any change in election at the time of open enrollment, which starts in the next few weeks. If you want or you choose UT Select, you're automatically enrolled and will receive this benefit. Now, all of the UT Select benefits essentially go forward as they have in the past. So you get the same deductibles, the same co-insurance rates, the same co-pays for a non-UT provider. However, if you receive your care at UTMB, UT Houston, UT San Antonio, and UT Tyler, you get a reduced copay. So $20 instead of $30 for primary care, $25 instead of $35 for specialty care, and you get a 90% coinsurance rate as opposed to 80%. Okay? So we think that's good. That's a good thing. We think it's good for our employees. We think it will help us do a better job in reducing the cost of health care for employees who receive care at one of our institutions. This will begin on September 1st and will be in place. And basically, we're doing this as a trial to see what sort of response we get, how it impacts the overall health insurance plan, as well as the providers, who also have had to make some concessions to make this work. So here's the chart that I was trying to describe. Again, UT Select plan, here's the basic benefit plan. If you come to a UT institution, UTMB, UT Houston, UT Tyler, UT San Antonio, reduced copay, higher coinsurance, no inpatient copayment. Deductibles remain unchanged. This just again shows the institutions where these benefits are available. Now, the reason that UT Houston and San Antonio don't have any inpatient copatient changes because they don't have hospitals, okay? UTMB and Tyler do. So the hospital change applies only to UT Tyler and UTMB. If you go to Methodist or Clear Lake or Kelsey-Seybold or some other UT Select provider, included provider, but a non-UT provider, then you don't get those benefits, okay? Everybody understand that? So again, you don't have to make any change in election. You just choose UT Select when you enroll for health insurance, and you will receive these benefits if you receive your care here at one of the other 3 UT institutions on the slide. So again, we think that's a positive, very excited about that, and hope that it works and we can expand the benefits over the course of time. All right, I mentioned UTMB Discover, the big data analytics project. Very important to us. We have new tool sets that are available for us, and we'll continue to roll out the tool sets over the course of the next year and beyond. Now, what this really allows us to do is to look more completely at the outcomes of our work, or in some cases, the processes that lead to outcomes, and make sure we really understand what's happening with delivery of care, with the decisions we make, with some of the research projects or research processes that we have. So hopefully will help us improve our performance, help us with that drive towards excellence that we all have. So anyway, more to come about this. Things are moving along nicely. We need to do this. We need to make these investments, understand how to use these tools more effectively if we're going to be successful with best care, if we're going to continue to be competitive for research grants, if we're going to continue to be able to optimize our education programs. We need to understand what we're doing and what occurs in terms of outcomes. So that is the focus for UTMB Discover. All right. Last thing before we move to questions. Those of you who aren't already playing with your phones, take them out. Hold them up. All right. Activate your Facebook app. I actually have it on my phone. I don't think I've ever activated it, but I'm just kidding. All right, so go to Facebook and look at the search bar at the top. Okay? Type in I am UTMB. I see Dr. LeDuc working at this. All right. All right, when that comes up, hit like. Okay? And what this will do is it'll help make sure that it shows up on your news feed on a regular basis. We're using more and more social media opportunities to present information about what's happening here at UTMB. We've done a lot of good work with patient education, with social media apps and outlets, and we want to do more in terms of keeping our employees informed about things that are happening at UTMB. So the I Am UTMB site has a lot of great information about what's occurring here, items of interest. And of course, if you're just thumbing through Facebook, these things will typically come up on your news feed so you can keep up with what's going on. So it's out there, and we'll continue to work to improve that. If you have thoughts about what you see there, please let us know. Let Steve Campbell know. And we'll make sure we try to incorporate those thoughts into our plans for how we use this site as we go forward. So thank you. All right, so in closing, best care, making good progress. We still have work to do. We want to stay focused on that and make sure that is at the highest level of priority across the institution. Growth and modernizations, we continue to grow strategically, aggressively in our highly competitive markets, becoming more competitive all over the course of time, making investments in programs and facilities to make sure that we stay competitive. Financially, we're doing well. We want to continue to use our resources wisely, make sure that we track our performance closely, and get the best value for the investments that we're making, make good choices about those. Finally, the legislature, I think we did about as well as we could in a very difficult session. We'll continue to work with our legislative elected officials and their staff members as we go forward to try to make sure that they're as well informed as they can be about what happens here, and that we do everything we can to help them make good choices as they go forward. So thanks very much. Thank you for being here today. Thanks for all the great work, and I'm happy to take any questions that you have. Tilly, you have one? All right. This is one that came to the EAC? Okay, thank you.
We received a question regarding the UTMB sick leave pool. The original question included details about the employee's personal situation, so we won't read that word for word. But the person who wrote in wanted to know how UTMB interprets and applies our university policy in comparison with the state law and that establishes sick leave pools for state agencies. And is our practice consistent with how other UTMB components implement their sick leave pools?
Okay, thank you. Yeah, I actually got a chance to see this question, and it seems like I receive a question about the use of our sick leave pool, feels like about once every 6 months. And so it's being used with some frequency. Now, I don't know the exact content of the state law. Our HR experts keep up with that. And what I see basically is a fairly broad state law which requires that a state agency, and so we are considered a state agency for the purposes of the law, and actually each of the UT system institutions is considered as a separate agency. So we all have to have our own sick leave pool or some accommodation to manage sick leave and make accrued sick leave available for employees. And so there's not a whole lot of very specific guidance in the law, but in general, what we do is in accordance with what other state agencies do, and particularly in accordance with what happens across the UT system. Now, that said, there are some differences. Some of the things that I've seen, for example, most of the UT system institutions require that all other forms of leave accrual, so for example, vacation, be exhausted before someone can apply for available sick leave pool dollars. There also, in general, is a proviso that to use sick leave pool days, that someone has to be in a very threatening situation in terms of illness, very acute illness, very sick. And the sick leave days can only really be used towards the recovery, return to good health from that illness. And there's some variations in how that return is described. And so, I know Felicia Evans is here today. She can talk about this in more detail. I'm happy to have her do that. But I think what we should do, and I've already talked to our Chief of Audit Services about this, is just have our auditors, who are independent, if you will, gather information about best practices, what's happening across the UT institution, the UT system institutions, as well as across some other state agencies, and just bring that back to us, take a look at where we stand currently. Because if this is like a lot of other things, it's constantly in flux and best practice may be shifting around a bit. And I want to make sure that what we're doing in terms of management of our sick leave pool is consistent with best practice across other state agencies. So whoever submitted the question, I appreciate it very much. We will take a look at where we stand relative to what we would consider best practice around the state of Texas, and if we need to make adjustments, we will do that. So thank you. Other questions for me?
Are there any plans to extend tuition reimbursement beyond nursing staff for the new fiscal year?
And Cheryl, remind me, nursing staff and some hard-to-fill positions, right? And so that's how we've been managing this going forward. We've left that the same for FY18. We continue to look at the opportunity to expand the benefit, so including more people, expand the total amount of dollars up to the IRS limit. We'd like to be in a situation to do that financially. So we're hopeful that we'll be there in 19. It's up there on our list of things to do. Just with these tight budget times over the last several years, that's one of the things that we haven't quite got funded yet. So we continue to fund basically our hardest to fill positions, which include a number of those in nursing, as well as a few others around the institution. And then we hope to expand it over the course of time. So thank you for the question. When I go around and talk to people around the institution, I almost always hear about this. Can you please expand tuition reimbursement? Can you do more to help us acquire additional skill sets or additional education? So we understand there's a desire and a need. We certainly are keeping that top of mind. We'll do the best we can with that over the course of time. Other questions or comments or suggestions? All right, thank you all very much. Don't forget about the hot dogs.
UTMB Health, working together to work wonders.